oh my goodness, uh, maybe 25 years, something like that. He actually wrote a book that I helped him to edit. So we go back a long time.
Yeah, I remember. I've known Chris since he was a little boy, so I go back further.
Oh my goodness.
Yes.
Oh, that's wonderful. Good
Which
deal.
is, you know, Chris is not little by any
Yes.
imagination.
Yeah. Yeah. Good deal.
Yeah.
Good deal.
So, but anyway, yeah, I really appreciate you taking the time out. Mikey, do you want to start talking to him and asking him some of your questions?
I don't really have
Brown?
or I guess, sure. I mean, I don't really have questions. I just more have like statements, I guess.
Okay, we can start there.
For a 16-year-old, would CBD affect me in any bad way?
So there was a huge issue with marijuana, and that's what it started off with in Colorado when they legalized it. And the big issue there was the THC component, which is the psychoactive component. So everything that I promote, primarily in my clinic and my practice, is CBD, which is derived from a hemp plant. By federal law, it has less than 0.03% THC. So technically, it can't really have a psychoactive effect. I've never seen that with any of my patients. And that's why it's federally mandated to have that low amount, because it doesn't have a psychoactive effect.
Right. But is it illegal for a 16-year-old, obviously, to take CBD unless it's
I
prescribed?
can answer that for you.
Let him answer.
Yeah, actually, you go ahead.
Right?
So all of these products can be bought anywhere. You could go to your neighborhood drugstore and find it. So
It's everywhere. Yeah, I know. Yep.
So because of that, it's not illegal. They don't card people at the drugstore to say, how old are you to take this?
Plus,
But-
the psychiatrist has also said that it would not interact with the medication that Michael is taking, and did not feel that it would have a negative effect on him.
So what medications are those?
Just Exalipram, one medication.
Besides that, any others?
None.
Okay. So is that prescribed by your primary care doctor or a psychiatrist or
Psychiatrist.
Okay. So everybody is different, but the literature says that there should not be an interaction. However, your physician should be guiding you, because sometimes as the endocannabinoid system is getting modified and modulated or improved, you may be getting too much of the prescription medicine. So that's why it's always good to work hand in hand with your physician, with your prescribing physician, so that this way they can modify the medication. For example, I literally saw a patient yesterday and I had to increase their prescription because they're going through more of a stressful time. So it's always good to work hand in hand with your prescribing physician. That's really your partner. And if they're someone that's remotely reading the literature, they should know all about CBD, and they shouldn't have any issues with CBD.
Laura, Dr. Chang said he didn't have a problem with CBD, but that was it. He didn't give us any direction on dosage.
He said that there's not enough testings. It's more of a political issue. He said he did not have a problem with it. And as you know, we have an appointment with him coming up in October. So if, as both doctors are saying, that we work with them and let them know, what direction or what.
Yeah, So it's kind of interesting in that the initial literature turned out to be in neurological diseases and two rare type of seizures in adolescents. So actually the literature started off and an FDA drug was approved that's based on CBD. So I'm not quite sure why someone would say there's not literature when there
Is.
Well, you said there's not a lot of scientific, I mean, there's just not a lot of testing and, you know, a lot of information.
That I would agree with because
Right. I may have said it incorrectly. I'm sorry.
no. My primary interest is musculoskeletal medicine and functional medicine, and as a result, going through the literature, and I'm actually preparing a lecture for 2 weeks, so I'm going through the literature again to see what's new out there, and there's not that many human studies, and that's what the FDA likes to see is human studies. In other words, someone is taking it and they can report back, as opposed to a dog or a rat who can't really report back. They just, are either happy or not happy or something like that.
So Mikey's primary reason for wanting to take CBD is more emotional stress,
PTSD,
anxiety, that type of stuff.
Wow.
Where CBD is, like you said, more muscular, or at least that was the original reason for CBD, is to help with arthritis and muscle pain and that type of stuff, correct?
So you're partially correct. And I just came across an article 2 days ago now, I think, something like that, from the VA. And the VA is starting to promote CBDA specifically for their vets with PTSD. So I feel pretty comfortable if the VA is recommending it, then it's probably okay. Or if they're not recommending it, at least they're saying, hey, it's okay for our vets to be taking it.
Okay.
Yeah.
That's good.
And so is there a preferred way for a 16-year-old to take CBD?
So it's not just a 16-year-old, it's anyone.
Okay.
And this is how I take mine. It's sublingual. So you drop it underneath your tongue. There's a lot of lymphatic vessels there. In other words, things that kind of drain into the bloodstream. And that's the most effective way to kind of get it in your system, if you will. It's the absorption is too unpredictable if you try to swallow it. So that's why the best way is under your tongue. So what I usually do is before I head out the door in the morning, I drop it underneath my tongue and then I drive to work. So that this way it's absorbing. You'll find most literature will say 30 seconds to a minute. The longer you hold it there, the better off you are. So that's why I do mine on my drive to work.
What about side effects?
So I've not heard of any side effects. There are some drug interactions, and those are the medications that utilize a specific pathway. And the classic pathway is if someone tells you that you have a hard time or you're not supposed to have grapefruit, then it's that pathway. So the classic example are medications like cholesterol medicines. I can't imagine that being 16, he's on a cholesterol medicine.
No.
So most likely there's not going to be a side effect from that standpoint. The other side effects that I've heard can be drowsiness, just because it is helping to kind of relax and reduce the anxiety. So when you reduce that tension, people feel a little bit more relaxed and they may feel drowsy. I have people that are taking it twice a day, myself included. So I not really heard of really any side effects.
Is there a bad taste to the oil?
So you can get flavored ones, and the company that I use, I believe it's peppermint. I don't use that one yet. I've ordered it, and we'll talk about that in a second. The one I'm currently used, it might taste a little bit like an extra virgin olive oil, only because it has kind of like a raw vegetable type of taste, maybe.
Mhm.
But I, I've never heard anyone tell me that they just don't like it.
Yeah. But gummies is also a very good alternative, correct?
I'm sorry, you.
A gummy?
Oh,
Edible?
no. And the reason why is gummies, you have to ingest it, so it's going into your stomach, and as a
Okay.
result, that's where the absorption is unpredictable, because you don't know what you ate before that, or maybe you're under a little bit more stress, so you're dumping a little bit more acid into your stomach. So as a result, there may be a little bit more absorption. So that's why sublingual is really the go-to.
What about, well, do you recommend smoking it as well? Because not through the vape carts, not through the vape, the actual flower itself. Because I know that is a very quick way to get instant relief, and it not really has like a cancer side effect. Just makes your lungs inflamed, or basically you cough.
So, yeah, it's a great absorption method, but I can't really recommend that anyone inhale any type of burning product. I mean,
Right.
it's just unfortunately not good. If there was a way to vape it that was safe, that might be an alternative, but I haven't seen a safe vaping mechanism.
Oh yeah, I don't vaping
Yeah.
it. That's not entirely great.
Yep. So the oil is obviously the
Yeah,
way to get it into the bloodstream.
yeah,
And what
Yeah.
dose it?
And so how do we know what kind of dosage that we would want to start with, and then how do you progress? I know that you have to start, or I've read that you have to start low and then you increase,
yeah,
yep,
yeah.
from there.
So the typical starting is 1 to 5 milligram per kilo. So a kilo is 2.2 pounds. So you take the body weight, divide that by 2.2, and that's how many milligrams you start off with. And then most people, if they need more, might go up to 10. I have one individual that's up to 20 milligrams per kilo. But like I said, that's just one individual. So you have to kind of try to maintain everything the same. So that means the prescription drug stays the same. You keep with the same dosing of that, and then you just try to affect the system by changing one thing, and that would be the slowly increase of the CBD.
And I was going to ask another question to another.
When I look at the different companies that offer it online, they have anywhere, they have like 300 milligrams to 5,000 milligrams. I mean, like the bottles, they have like a measurement on them.
That's because the bottle is milligrams. It's what's telling you that the bottle milligrams, it's not telling you the actual milligrams of CBD. I'll teach you when I come down.
So you're kind of correct, and that is on the bottle, it usually states how many milligrams of CBD is in that entire bottle. So for example, if there's 1,500 milligrams, and usually standard bottles are 30 mLs, that means that there's, if I'm doing the math correctly, 50 milligrams per ml in that 30 ml bottle of 1,500 milligrams. You just divide 1,500 by 30, and you come up with the 50 milligrams per ml. And then most companies will have a dropper, and on the dropper, it'll have gradations. It'll say 0.25, 0.5, 0.75, and 1 ml.
And I noticed it's like some of them are cannabis oil and some of them are, or I mean, it's like hemp. I mean, there's like two different kind of things. I think you were telling me the last time we talked, 100% organic, third party tested.
Mhm.
I don't remember am I forgetting anything else?
There are
Broad
hemp,
spectrum is what we heard.
No.
We heard from somebody that you want to cover a broad spectrum.
so it gets confusing. And full spectrum and broad spectrum sound really similar, but they're not. Full spectrum is, I think, what you're alluding to, and that is it has everything, including that tiny bit of THC. Broad spectrum, which sounds like it should have a lot of things, it does, except for it doesn't have any THC. So there's not really that much difference because the amount of THC that we're allowed to sell because of federal guidelines is, again, that 0.3% THC or less. So for all intent and purposes, full and broad are pretty close.
So where do we purchase, or where we know what we're getting? The organic, the full spectrum, the
It'll stay on the bottom.
full, third party testing, all that stuff. Because like you said, I can go right down to the corner store and buy CBD. It's all over the place.
Sure. I told Jovi when we first started this whole process, there's a company that I represent, and I know the owners, and I've known the owners and good, solid people. I don't know if you're faith-based, but they're faith-based. So they're solid, and they have a good integrity. I did my research. They have the highest amount of CBDA, and they also have the longest money back guarantee, which is 60 days. So that's the reason why I chose that, because they have a great product. They have an impeccable guarantee, and they're just good, salt of the earth people.
And we can order this online.
Mhm.
Yeah. And what's the name of the company?
It's called CTFO.
CTFO.
Yeah,
Okay.
it stands for Changing the Future Outcome.
Okay.
Okay.
Are they in Colorado?
No,
No.
actually they're in Vacaville, California.
I figured.
Okay.
Where are you guys at?
Illinois.
In Illinois.
Okay. And they source around the U.S. wherever they can find organically grown hemp.
Okay. You have any
What?
questions, bud?
I know you don't recommend smoking it, yada yada, but would that still be an option? I guess as on the board. I guess because edibles take longer, and you never know what they're gonna do. Can I speak?
Go ahead.
So basically you never know if when it's gonna kick in, yada yada. So for smoking it and then the oils, so that would be on the table then, smoking it wise. I know it's not great for you though. Lungs wise.
Yeah, of course it's on the table. However, as a physician, I just have to tell you that it's not the greatest thing for your lungs. And especially for someone that's young, it's not a good idea to taking in any type of inhaled substance. I don't know if Jovi told you, but I'm in Reno, Nevada. And even though we're, 200-300 miles away from California, we're still getting the smoke from all the California fires. So just imagine inhaling that every day and what that does to your lungs. then you throw on top of that COVID, and the big issue with COVID is what it does to the lungs. It introduces this horrific inflammatory response, which is called the cytokine storm. So, I mean, in good
risk.
conscience, yeah.
It's a risk. Yeah.
It's a big risk, and
Yeah.
yeah. I mean, I'm definitely not a component of
Smoking it.
proponent of smoking anything. Period.
Yep.
Nor will I be.
Yep.
The oil, for sure.
Yeah, I know.
Now, is it, so when you take it in the morning, about how long, does it basically help you just to relax for the day, or how does that work?
So everybody is different. And again, it depends on where you're at in that endocannabinoid spectrum. Some people can feel an all-day response, and that's what most people do. Some people need to have another kind of dose, if you will. I have one patient that takes it 4 times a day. So everybody is different. And I wish I had a better answer for you than just starting kind of slow and bring it up.
Yeah, slow and low, you said,
Yeah.
first time we talked.
What about a withdrawal from it? If he's taking it and he doesn't take it for whatever reason, are there any symptoms of that or side effects like that?
No, because it's an oil, and because of how CBD and THC is absorbed and retained in the body, it actually doesn't have any type of withdrawal effect. Again, everybody is different, but I've not seen any type of withdrawal issues. Yeah. No.
Okay.
Will he build up a tolerance to it, to where he will have to increase dosages and all that?
No.
No.
If anything, and this is what I typically see, as people get better, they'll reduce the dose because their endocannabinoid system is working so well.
Okay.
The other thing that goes along with this whole issue is what's happening in the body in general. And that's what Christopher has spoken about in his group, or in Jovi's group, I should say, and in what Christopher has talked about in his book, and that is just trying to reduce the inflammation within the body. Most people, the typical American diet isn't that great. So anything that we can do to help reduce inflammation in the body is going to be tremendously helpful to allow the body system to naturally recover and heal.
So in order to buy CBD, you have to be age 18, don't you?
Anyone, he
Do
said.
not.
You already said that.
Okay.
Yeah.
Okay. All right. I just wanted to make sure, because I thought for sure that you had to be 18 or 21 to buy CBD.
No.
So, okay.
Okay.
All right.
Well, Mikey's checked out already.
Okay, well, they have another group coming on now. So thank you so much. We really appreciate your help.
Yeah.
Yeah.
Thank you.
Anytime.
Yeah.
Anytime.
Fantastic.
Okay.
Good information.
You will.
All right.
Thank you.
All right.
Bye.
Bye.
And Laura, you can stay on if you like. I have the
Oh,
others.
sure.
Okay,
Yeah.
let me just admit the other people on.
Oh, did you lose Dr. Phillip?
Oh. I think he dropped. Hold on. Let me text him real quick.
Hi, Jovi.
Hi,
How
how
are-
are you?
Find yourself?
Good, good. Give me 1 minute. I'm trying to
Sure.
get Dr. Phillip back on.
Okay. I'm also driving, so just in case you don't see me, I'm still here. Okay. I got my
Okay,
earphones. Okay.
Hey, Christina, how are you?
I think that He's awesome, Dr. S. And I think Mikey was upset because he really wants to smoke it. Did you get that impression?
Yeah, I did.
And I know there's not going to be a doctor in America that's going to recommend him to do that. So
No, nobody. Yeah, no.
yeah, we'll see.
I think he forgot.
Yeah.
Okay, let's see. Hey, Dr. Phillip, sorry about that.
Oh, no
I
worries.
said we had two groups.
Yeah, no worries.
Hi, doctor. How you doing?
I'm doing well.
Great, great.
So I have Martha and also Christina on the line. I had a few other ladies, but I don't know where they're at. I've been texting them.
Okay. Martha, are you driving safely?
Yes, I am.
Hands
Yes,
free.
I am.
Okay.
Just keep walking.
How are you doing, Christina?
Good.
Good.
Just getting ready right now. That's why I don't have myself on the camera.
Oh, okay. So this is Dr. Phillip, and I was wanting to introduce you to him. I know that several of you had questions. So about the CBD oil. So just a little bit about yourself, Dr. Phillip.
Sure. So my background is primary care, and I have a fellowship in sports medicine. So my whole career has really been about musculoskeletal medicine, musculoskeletal injuries, functional medicine, integrative medicine, trying to help people stay healthy or return back to good health. My interest in CBD started about 2.5 years ago, actually 3 years ago now, when the state of Nevada said, in order for me to prescribe an opioid or narcotic, I have to jump through these onerous hoops and do drug testing and do follow-ups and have them sign a contract. And as a result, most primary care got out of doing any type of prescribing. So then that left a huge void. So I was hearing about CBD, and a person I met in a Bible study actually owns a CBD company. And when I found out about that, I said, so tell me a little bit about it. He told me about it. I did research, and through that research, I started doing lectures, and I've given 4 now, I think. And I'm doing another lecture to a national medical group in 2 weeks, because I think it's so important that people not only get out of pain, but help their body naturally, inherently kind of heal itself, if you will. So, long nutshell. Sorry.
No, that's perfect. So I know, Christina, you had a question in reference to migraine headaches. Is that correct?
She's muted.
Oh. Christina?
Hello?
There you are.
Hello? Okay, sorry. So, yes, I've been suffering with migraines for about 15 years. I've done everything. I've gone to a chiropractor. Right now I take a migraine medication called sumatriptan.
Mhm.
And that's what I use when I am wake up or have the migraine. It does help. But there is times where it doesn't, where I'm actually in a room in the dark, even nauseous and throwing up. They get that bad.
Mhm.
It's gotten to the point where there's times that I have gone to the emergency room where I have to get morphine sometimes
Mhm.
just to get the migraine to go away. And even with that, I still have a migraine, but it's not as bad as when I first walk in there. But yeah, I get migraines. It could be times where I don't get a migraine at all for a week or two. And there's times where I have a migraine every single day. Like I wake up with, especially if I wake up with one, it's very hard for it to go away.
Okay.
So
So you said they started about 15 years ago.
yes.
And I'm told I'm never supposed to ask a female her age, but I'm gonna break that rule. How old are you? How old are you?
So I just turned 40 this year.
Okay.
Yes.
Okay.
So like I said, it was about 15 years ago. So I believe it started so I used to wear glasses. I got the LASIK surgery, and I remember the doctor telling me the side effects of getting the surgery. And I remember he mentioned that headaches you can get headaches after having the surgery. So I believe I got that from the surgery, but I don't know.
So the headache that you get after LASIK is usually because your brain is trying to readapt to this
Right.
new vision that it is. But once it adapts, it should pretty much adapt.
Right.
The reason why I was asking your age is sometimes women, usually it's either at the beginning of their menstrual age, so like teens or 20s,
Right.
or at perimenopausal, they'll have headaches. And that's when going through big hormonal shifts. The other thing that generally tends to make migraines worse is diet. So if you're part of this group, then you heard the whole spiel about eating clean.
Yes.
So that's kind of ruled out. So CBDA helps out with the neuroreceptors.
Okay.
It's not going to be a what's called, and I hate this word, but it's called an abortive drug, which sumatriptan is. You're supposed to take it on the onset of your prodrome, whatever that prodrome is. So CBDA is not that. It's something that you're going to take on a regular basis. And the whole idea is that it kind of modulates the neural receptors that may reduce the frequency of the migraines.
Okay.
But it's not going to be that magic bullet that you take prior to.
Yeah, because even my doctor has said, like how you mentioned the diet, there's like she gave me a whole list of things that can trigger a headache, and I've avoided a lot of those foods. Like especially like chocolate. If I eat chocolate, that's it.
Sure.
I'm in bed all day, like, with a migraine. So
Mhm.
anything with chocolate, let's see, MSG, I
Mhm.
know that triggers. So yeah.
Mhm.
But like when all of this first started, that I actually went to a doctor to, for them to check me, because I even got a CAT scan. I've gotten everything, to see if there was anything else, that was causing my headaches, and everything came out clean. So
Mhm.
there's nothing serious. It's just that my doctor said you just suffer with migraines. So
Yeah. So you said you saw a chiropractor.
I did.
Um, I I would try to find an osteopathic physician.
Okay.
And if you, I'm trying to think, probably the best resource is to call Midwestern University.
Okay.
Their campus is in Downers Grove.
All
And
right.
then from them, you can find an osteopathic physician that just does manual medicine.
Okay.
Yeah, there used to be, and this was back when I was in Chicago, uh, there was a clinic called the Diamond Clinic, the Diamond Headache
Yes.
Clinic.
Yes.
And I don't even know if they're still around, but
They actually are, because I actually
okay.
mentioned that in one of my visits that I had in the emergency room, one of the nurses told me there, she mentioned the Diamond Clinic. And then
Okay.
a friend of mine, her husband also has a lot of migraines, and he said
Okay.
that he went to that.
Okay.
So I did ask my doctor, and she said, yeah, I think St. Joseph's Hospital has it.
Okay.
Yeah.
So if you do go, make
Mhm.
sure that it's an osteopathic physician that does manual medicine that you see.
Okay. I'm writing this down.
Yeah, and a big reason is because osteopathic manual medicine or osteopathic manipulative treatment is in a lot of ways different than chiropractic adjustments or chiropractic treatment.
Okay. Yeah, because I think I went like for at least 6 months straight, and I would go 3 times a week. I mean,
Mhm.
it was helping me a little bit, but it's like I was still getting my every waking up, with one of them with a migraine. So,
Yeah.
and those are harder for me to get rid of
Hmm.
when I wake with a migraine. So, yeah,
Yeah.
like right now I have a migraine, but I try to avoid taking the medication
Hmm.
so much, because there's times where it makes me very drowsy.
Right. Right.
So,
Right. Yeah. So you can try the CBD oil.
okay,
The good thing is that it's got a 60-day money back guarantee. So, if you don't see any results in 60 days, then you return it.
okay,
But it has to be something that you do every day. It's not
yes,
a panic drug. It's not an as needed
mm-hmm.
type of medication, I should say.
Mm-hmm. Okay, all right, thank you.
You're welcome. And the last thing is,
Mm-hmm.
are you pretty much following a ketogenic diet?
No, I'm not.
Yeah.
But
Yeah. If you,
like I said, I try to avoid a lot of things that, like, I'm not gonna lie, I do eat foods that I'm not supposed to, but
mhm,
I not like an every single day thing.
okay.
You know, I do drink a lot of water, because someone told me that many times when you get a migraine, it's because you might be dehydrated.
Sure. Sure.
So that's what I do as much as possible
Sure. Sure.
during, every day. So,
Yeah, the reason for the ketogenic diet is that it tends to keep your blood sugar level at a relatively normal state, if you will, or
okay.
homeostasis. Anything you can do to keep your sugar from spiking,
Mm-hmm.
from insulin getting dumped, is going to help out tremendously, because those hormones just kind of wreak havoc on your body.
Okay. All right.
Who's next? Martha, did you want to ask
Yeah,
your
that's,
question?
yes, Dr. Phillip, I'm under very high stress. Recently being diagnosed as adrenal fatigue syndrome or whatever it's called. And I, I'm always super, super tired, but also too, I get insomnia because of my stress. And there's a factor at home where I'm having a child that is sick, and that's where I'm getting my stress from. But I cannot get rid of my stress unless I get rid of my child, and that's not what I want. So, um, would CBD help me to control that anxiety, that stress?
It may lower it, but you kind of already know what's going on. So it's kind of like wrapping yourself in a fireproof blanket and jumping into fire and hoping the fire doesn't get too hot. So
Well,
it may help, but I don't want you to have a false expectation that it's going to magically cure everything, because you're in the midst of a fire.
yes, and I understand that, and there's no way I can um, do away with that. I understand that myself, but at least somewhat to get a little control and not maybe live in a couple more years. That's what my expectations are.
I mean, you living a couple more years?
Yeah, I'm actually 68 years old, and I'm not that I'm knocking at the door. That's not what I'm doing, but I know that it's very hard to control sometimes my diabetes. It was when I started with Chris, it was like in the upper 200s. So
Okay.
right now I'm like, about, I'm gonna say in the mornings I'm 72, 100 to 120
Okay.
for the mornings. And then at night it does spike up in about 200, under 200, and then in the mornings it goes back again. So I am controlling that much better than what I was before. Before I started with Chris, but again, too, you know, I tell myself I want to live a little longer. Okay, I want to make sure that I live a better life than being handicapped and not being able to help my family, but mostly my son. That's where I'm aiming at. I need to be sticking around for him for a while.
So you're just barely middle-aged. So you've got a lot more years ahead of you.
Well, I'm hoping, yes.
There's no hoping about it.
Okay.
So I have a pretty strong faith, and the Bible tells me in Genesis 6:9 that I'm supposed to live to 120. So I'm holding God to that promise that I get 120 years.
Let's hold him to 120. That'd be
Amen.
great, doctor. Yes.
Amen.
Amen. Yes, amen.
So if you are going to try something, you would probably want the full spectrum just because of the diabetic background, and to try to get the entourage effect. So that may be beneficial for you. There is a sleep spray product that I use, and it helps me out fabulously. My wife tried it and she got vivid dreams. I kind of like the vivid dreams, so it doesn't bother me, and I sleep well with it, and I don't get hungover. So that may be something else you can try too.
Okay. I think Wednesday you said for me to try the CBDA. So I'm not sure how is the spectrum
Yeah.
different from the A.
Yeah, so please forgive me. I didn't realize your diabetic background, and I guess I should have just assumed that because of Jovi's group that most of you are going to be diabetics. So, yeah, forgive me for that. You would probably be better served with a full spectrum as opposed to something that has more CBDA than in it.
Okay. And let me just also emphasize that I've been diabetic for 20 years.
Okay.
And recently, you know, like I said, my glucose came up to almost 9. So I've been dropping, and right now I'm about a 7.2, 7.3.
You mean your A1C?
Yes, the
Oh,
A1C.
wonderful. Very good.
So
Very good.
I am, you know, with all the diet and all the effort that Chris has been putting, I am making a big effort, and because I do want to live. I do want to live, and I want to change my life. And if someone is willing to put the time, I better be willing to put that time, because my life is worth it, and I wanted your time to be worth it because you're saving lives, and I want to save my life. So
Amen, Martha.
thank you.
You're welcome.
Thank you.
You're welcome.
So, you know what? You both are fabulous, and the way your work is being done, and I don't think we could expect any better people. You are so nice to us. Thank you.
Bless you for the kind words. I'm here to serve.
Thank you so much.
You're welcome.
So then just try the CBD spectrum, doctor.
Yeah, the full. Yeah,
Okay, the full.
I would try that. And then the sleep spray if you want something specifically to help you out with sleep too.
Okay. Now I'm gonna ask you something. Can people with schizophrenia use the CBD?
They can. The issue is trying to make sure that someone gets it on a regular basis, and not only get it on a regular basis, but they're absorbing it. So in other words, they have to be able to hold it underneath their tongue for 30 seconds to a minute, maybe a little bit longer if it's possible. And people with psychological disorders, that's kind of tough. The other thing is it has to be done in conjunction with the psychiatrist. So that this way the psychiatrist can monitor the medicines to make sure that as the CBD is working, then the prescribed medications can be what we call titrated or adjusted for the positive effects of the CBD.
Okay. Okay.
Is there a good relationship with the psychiatrist?
No, he doesn't want to go to the doctor. He
So
doesn't
who's
want to.
prescribing the drugs?
No, he's not taking any.
Oh, I'm sorry.
No, he's not
Well,
taking
that's a
any.
different story. Okay.
Yeah.
So now the big question is, can you get something in?
I'm not even sure because he's very reluctant to take anything, but I did want to kind of ask that question. If in the future things get a little much more out of hand, you know, that's my problem right now. That he gets a little hyper, and it's a little much on me emotionally, and sometimes it gets a little verbally abusive. So that's what I'm getting all my stress from.
Sure. I know it's tough being a parent and wanting to do the best you can for your child. Sometimes the best thing to do is to get them help, which means you commit them. And I know that's extremely tough for a parent. I have dear friends of mine who have 2 kids on drugs, And finally, they said, we can't help you anymore. And they didn't bail him out of jail. And one of the kids is still in jail. The other kid hit rock bottom in jail and finally said, okay, mom and dad, I'll do whatever you want me to do. And then that one was put into a program, and that program turned this young lady's life around, and she's now leading a wonderfully beautiful life because the parents did the tough thing of saying, I can't do this anymore.
Well, I have committed my son 3 times already, and it just gets worse for me because he blames me for everything, which I understand that. I mean, someone's got to take the blame, and I don't see where it ends. That's my main thing. And then,
So, I'm sorry, go ahead.
no, so that's where I'm at. That's all I was going to say.
I would imagine there's some type of aid program, behavioral aid program that can help out.
Okay.
I don't know, Martha. I'm not in. You're in Chicago, right?
Okay. Yes, I am.
Yeah. I don't know what the health environment is in Chicago. But I can't, for the life of me, I don't understand how a institution could just turn someone out on the street without any type of bridge type of care. I don't understand that.
Well, they did away with a lot of mental clinics. So that's one of the reasons too. So, you know, you can't keep surviving if the government doesn't pay. So, I mean, I don't have all the money to pay some psychiatrists or psychologists for that same illness. So
Sure.
I'm in a bind also on that. So
Yeah. Is he part of some type of state aid insurance?
yes, he is.
And doesn't that have any type of behavioral benefit or?
It does, doctor, but he's the one that refuses to even ask for help. So that's, I just thought maybe with the CBD that would kind of help him kind of the anxiety, maybe just his own stress kind of be minimized.
Sure. Wow. You got me on that one, Martha.
Okay. It's fine, doctor.
All right.
I know I got myself into it too. So I understand where, I understand the level of where I'm coming from, and I know I'm in the fire, but you know what? He's my child, and he's not a child anymore. He's an adult. But again, too, I cannot throw him out in the street and let him be that, to be homeless. I cannot do that. I fight myself every day, let me tell you, because I know the right and I know the wrong, and I'm trying to keep a balance in my life, and it's not, the balance doesn't always come through. So that's, but again, too, this way you can understand where the stress comes from on my part, and just hopefully that the CBD can help me just kind of release some of it. So
Sure.
but thank you so much for putting your information out there. I
Yeah.
deeply appreciate it.
Yeah, you're welcome. You're welcome, Martha.
Thank you so much. But I'm here to hear anybody else that wants to say something.
Okay.
Anna, you had a question?
Yeah, I know I'm late to the Zoom. and this is my first time, but I don't understand the difference between CBD and the full spectrum. What's the difference?
So CBDA is just one component of the full spectrum. There are many different types of cannabis oils within a product. CBDA just happens to be the most potent one. So depending on what the issue is, there might be a better use for the CBDA product that has more of that, as opposed to the full spectrum. And that's a little bit about what we're talking about with Martha, in that the full spectrum has usually more of an entourage effect. It has more of the other things like terpenes in it and the other CBs. So people that have neuropathic issues or immunological issues, usually the full spectrum is probably a better product than the product that has more of the CBDA in it.
Okay. Well,
What-
I'm not diabetic, and
Okay.
I am postpartum menopausal.
Okay.
I had early menopause. I went through menopause at 27 years old.
Wow.
Yes, I'm 40 years old now, and I just started taking hormone replacements. I've done it on and off throughout, since then, but I don't like the side effects that comes with taking the hormone replacements. And going
So
some years without a menstruation or cramping or any of that, and then to come back to it, it's just psychologically and physically intolerable. I guess that's the only that's I can say.
sure. So who's prescribing the medication?
My OBGYN,
Okay.
she prescribed estrogen, but like I don't, and I know that it's also my fault. I don't like taking pills because I tend to forget.
Mm-hmm.
And so I opted for the Compi patch, which is you change it out every 4 days, but
Mm-hmm.
the side effects are spotting, cramping, and stuff like that. And then so she, along with that, she prescribed progesterone, which help counter,
Sure.
but it's not working. And so I'm having cramping and stress and not sleeping well anymore. And it feels like I'm getting more of the hot flashes that I did when I wasn't taking hormones.
Mm-hmm.
So
Yeah. So unfortunately, women are a delicate balance, and every body is different, and you just have to work with your gynecologist to find out what's going to be the right ratio for you. The unfortunate thing is that you still have a uterus, so you still have to worry about the menstrual flow, and you still have to balance the estrogen and the progesterones, because if you don't, then you're going to get spotting.
yeah.
So really, unfortunately, it's just working with your gynecologist to find that sweet spot for you that's going to balance you. Now, in the interim, you can try one of the CBD products, because anything that you can do to help modulate the endocannabinoid system is going to be beneficial. Hormones will affect it, and that's why it's best if you could get that system kind of baseline at a steady state. Then it might be easier to control the hormones.
Yeah, that's kind of where we're at. We're messing with finding the balance.
Sure.
But I did stop by at a CBD shop, and I purchased I think I just got it right now. It's like a full spectrum blend, and it's just one of those a drop that you put under your tongue, and it helps with sleeping.
Okay.
but I'm not sure if I'm using it right or what, you know.
So usually the bottle will have the amount of milligrams that's in the whole bottle, and then you just divide that by the liquid amount in the bottle. And most bottles are 30 mLs. So, for example, if it's 1,500 milligrams and it's a 30 ml bottle, then you're getting 50 milligrams of CBD per ml. Most people start out about 1 to 5 milligrams per kilo. A kilo is 2.2 pounds. So you just divide your body weight by 2.2, and then that will be how much you start out with, multiplied by 1 to 5.
1 to 5.
Correct. So when you purchased that, were you given any type of guarantee that if it didn't work, you can take it back?
No, it wasn't. But
Okay.
it's 2,000 mgs, and it is like I can't read how many ounces it is. Or yeah, it's 30.
Okay. So off the top of my head, I think that's around 67. You can do the math. But I think it's about 67 milligrams per ml. So, and again, it's 1 milligram to 5 milligrams. And we use kilos. So for you, you would just divide your body weight by 2.2.
Okay.
Does that make sense?
Yes, I'm writing it down.
Okay, good deal.
All right. Yeah, so that's mainly my issues is also the pain of it, and also I do have a herniated disc, so I live with constant back problems, like stop pain.
So for you, you would probably want something that has a little bit more CBDA,
Okay.
just because of the mechanical irritation and the mechanical inflammation. So if that bottle doesn't work, then maybe try something different.
Okay. Thank you.
Sure, sure.
That was all I really had. If anybody else
Okay,
wants to do it, they can.
good deal.
Josie, you had a question?
How does the CBD oil help with thyroid? Does it help?
So again, anything that affects hormones is going to be beneficial. And the endocannabinoid system cuts across all body parts, all physiological mechanisms. So if you can reduce inflammation within the body, then it's beneficial. And usually thyroid is an autoimmune type of an issue, like a Hashimoto's type of an issue. And anything that you can do to reduce inflammation and modulate the endocannabinoid system and thereby the immune system, it should be beneficial. So again, probably more of a full spectrum than something that emphasizes the A component of CBD.
So that's the one you recommend, the full spectrum?
That'll probably be better. Yeah.
Okay. Okay, I'll try that then. Okay, thank you so much.
Sure.
Is there any other questions, you guys? I think
I'm
we
fine,
went
thank you.
over Dr. Phillip.
Oh, no worries. No worries. No worries. I'm here to help.
Thank you so much.
Thank you, doctor.
You're welcome. You're welcome.
Yes, thank you so much.
Thank
Okay.
you.
Okay.
You.
So Jovi, just tell me if you want to do something again or when you want to do something again. I'm more than happy to help out.
Okay, perfect. I really do appreciate it.
Oh,
Thank
you're
you for
welcome.
all your time and the education that you're giving us.
Oh, you're welcome. You're welcome. Glad to help out. Glad to help out.
Thank you.
All right.
Bye.
Thank you. Bye.
Thank you, doctor. You take care. Have a good weekend. Thank you.
Thank you, Martha. God bless you.
Bye.
You too, doctor. Thank you.
So ladies, I'll go over a few things and I'll send it out to you, especially the one that Dr. Phillip does recommend. I'll forward that out to you.
Yes.
Okay.
Please.
Okay, Jovi.
Okay? And
All
I'll
right.
talk to you, Martha, on Tuesday.
Yes. Okay. Thank you
Okay,
so
and I'll
much.
see you tomorrow. You're welcome.
All right. Thank
Have a
you.
All right.
good
Bye-bye, ladies.
Bye.
Bye-bye. Take care.
Bye, Christina. I
Bye.
can't
Thank
see
you.
you.
Huh?
I said I can't see you.
You know I don't like being on the camera. All right, then I'll talk to you later, okay, Giovanna?
All right.
All right, bye. Thank you.
Bye.
Okay.
You're
Bye-bye,
welcome.
everybody.
Bye, Martha.
Bye-bye.